Hi, I'm Art Kaplan, and I'm the director of the Division of Medical Ethics at the NYU School of Medicine. Michael Parnell is a 4-year-old in Philadelphia. He has two twin brothers who suffer from a very rare immune disease, and the treatment for them is to get a bone marrow transplant. Michael's parents are all for that, and they have been telling Michael that he can do a heroic thing. He can be a superhero. They bring up analogies to comic book heroes and things that you might see on a film that a 4-year-old would pay attention to and say, you can do the heroic thing, you can help your brothers. And Michael says, yes, I want to donate the bone marrow. Is this right? It's interesting because in the past, we've seen families conceive a child to hope that they would get someone who is a match for another sibling who needed a bone marrow transplant. So parents can go quite a distance to find a matched bone marrow donor. Now, there are bone marrow banks, and some patients may ask, should they register or become a member of the National Marrow Donor Program? And I think the answer is yes. I'm myself registered there, and I helped found that organization, was on the board. So sometimes you can find a donor and you might not have to use a child, but to be honest, the best matches are going to come from close biological relatives. Well, I think Michael's parents are doing what parents are going to do, try to help their children, and you know, it's Sophie's choice. You don't want to say, well, Michael, if you said no, we're going to go along with that. I'm sure they're going to push as hard as they can to rescue the younger twins. But I think these kinds of cases, while I wouldn't prohibit bone marrow donation from a 4-year-old, I do think they ought to get looked at by an independent judge. In this case, I might say, let's have literally a judge take a look at the situation. Make sure that the child who's being asked to be the bone marrow donor doesn't have health problems, that the parents aren't minimizing risks because they want so much to help their other children. Make sure that there's no other real option, that they're not putting the child forward when one of the parents themselves might be a donor to these twins. So I do think independent review is key. 4-year-olds can't consent. 4-year-olds under a lot of pressure from their parents can't consent. A child who's been conceived so that they could be a bone marrow donor for a sibling, they're not going to be able to really consent. In the absence of consent, ethically what we have to do is look for more independent review. Bone marrow donation isn't easy, it's painful. I don't think it has a high risk of death, but it certainly can leave you sore and achy. It might require a second bone marrow donation if the first one were to fail. So there are, risks and burdens that a child would face. Having someone outside the family, having someone outside the caregivers take a look and make sure that it's a reasonably safe option, not going to put the child at too much risk, seems to me to be the way to handle these cases. I'm Art Kaplan from the NYU School of Medicine. Thanks for watching.